Joining us now on the bottom line on the brewing healthcare debate is our chief Washington correspondent and host of This Week, George Stephanopoulos. Good morning, George.
Hey, Bob.
Well, this is going to be, without question, a huge political battle. And this is, do you think, going to be passed very soon? Or even ever? Is this a big split between the Republicans and the Democrats?
That is the big question. The president just kicking off the campaign with that speech you mentioned tomorrow in Chicago before the AMA. And Democrats believe that the stars are lined up for reform this year. They say they have strong Democratic control in the Congress. They say that the problem of, especially of health care costs, has been getting so much worse over the last several years that the major stakeholders, doctors, hospitals, insurance companies are all ready for some kind of reform. They say Republicans have been part of this process as well. But as John's piece just pointed out, there are some big debates and big dividing lines between here and getting health care passed. Number one, will there be that public insurance option? What kind of form will it take? Number two, how to pay for all of this. The cost of health care is between $1 trillion, $1.5 trillion. The president's outlined about $900 billion in savings and tax increases. Will Congress go along with those? If not, will they come up with others? If you don't pay for it, can you pass health care reform? And finally, this issue of whether each individual should be required to buy health insurance and whether businesses should be required to give them to their employers. Those are the three big issues going forward, and health care could fall on any single one of them, but the president is pushing very hard. Congress will be voting in June and July on this package, and the president hopes to have a final bill on his desk by October.
But you look at these numbers you're talking about, and these different sides. You get lobbyists on one side against this. 45 million Americans don't have these insurance for them. Do you think it's possible that the latter will actually win?
Well, right now you do have broad public support for increasing access for all Americans. It's now above 60%, and for controlling costs. The question is, will that number come down if as we face these other debates, the question of whether or not a government takeover of health care scares more people who actually have their health insurance and are pretty satisfied with it right now. That's why you see the president again and again and again in all of his speeches emphasizing that if you like the insurance you have right now, if you're satisfied, we're not going to take it away. The debate is really going to hinge on whether people really believe that.